Epicentre family. I'm Cheryl and I work as a physician in an emergency department in Glendale. I've been asked to give a COVID update as we walk out our California reopening. We'll talk a little bit about where masks are still required, give a disease and a vaccine update, and kind of do a little bit of a deep dive into vaccines and kids. And this is going to be a little dense. There are no graphs or pictures or charts, so okay, but it's absolutely real, so buckle up. All right. There has now been 33.5 million people in the U.S. infected with COVID, 178 million people worldwide. COVID has claimed more than 601,000 lives in the U.S. and 3.86 million people worldwide. Now, 20 years of research advances and a concerted manufacturing push has allowed warp speed vaccine production to reach new record efficiencies. So where seasonal flu vaccines were kind of reaching for 50 to 60% effectiveness, now COVID has pushed the 90% envelope to where we are at 95% with some. So now the US has a 45.4% vaccinated population, fully vaccinated, and 52.8% of those are greater than 12 years of age. So that's our vaccine eligible population. California right now is 56% vaccinated, and the world sadly is only 9% vaccinated. So what do these numbers mean? I mean, they're just really big numbers, and I just said them, and what does it mean? It goes in one ear and out the other. Well, the average flu season affects 35.5 million people, and that's roughly close to the same number of COVID cases that we've had. So while the incidence of COVID and of influenza is the same, the lethality, though, is distinctly different. COVID has been 18 times more deadly. And the 601,000 deaths from COVID in the US, well, that's roughly the number of all deaths from all cancers over the past 2020 season, all cancers combined. So COVID truly has had a life and death impact upon our country and the rest of the world. But like COVID's passé, right? So like there's hardly any new COVID disease and infections right now. California is finally open and I can ditch the mask. So we returned back to normal, right? Well, on so many levels, that answer is sadly no. Might I just offer one frame in a long video saga to offer you? We are now in the pandemic of the unvaccinated. Those who have attained vaccination, even one of two, and are 6 weeks into their shot, are fairly well protected, and they would be the rare exception to get a detectable disease. They would be rarer to get symptomatic disease, and they'd be even more rare to get significant disease. Those contracting COVID are now the unvaccinated. The India or the Delta variant is now spreading throughout the US. We were at like 7% nationwide in May. Now Missouri is 90% Delta virus dense, and the Cox Health System in Missouri is recording a 6-fold increase in COVID hospitalizations. There is no going back to Egypt. There is no normal before COVID. There is only moving forward into our new promised land. So on June 15th in California, we had the mandatory masking lift for all those who were fully vaccinated. And those who are not vaccinated must still mask for all indoor functions. Masks are required by all for all indoor venues hosting more than 5,000 people. So masks have to be worn even by vaccinated people if you're in an indoor venue that has more than 5,000 people. Masks are recommended for the unvaccinated folks who are at outdoor events that have more than 10,000 people. Mandatory masking, though, is in place for K through 12 schools, and that's why for all Epicentre campus gatherings, they are mass gatherings. We must respect that this is a PUSD school and that we must comply with California regulations. Also, all healthcare settings, prisons, mass transits, shelters, and cooling centers must also mask as well. The good news is that, however, well, even though we have some masks, our vaccines are working, and they're actually even surpassing our expectation. The vaccines have worked so well in the real world that they've actually stood up to the UK virus, the South American one, the South African one, and currently now the Delta virus. We're doing pretty good with that. So they are effective, but I guess the question on everybody's mind is, are they safe? So we've got 149, almost 150 million Americans fully vaccinated. 2.7 billion doses have been given out worldwide. We've given more than enough doses to figure out if there's going to be any problems with our vaccines. And in all of vaccine history, all of the history of just developing and administering vaccines, problems have always arisen in the first 6 to 8 weeks post-administration. And so what we have now, we have seen. What we are going to have with COVID vaccination problems, we have already seen. So what have we seen? Historically, in prior vaccinations, we had paralysis from the polio vaccine. We've had swelling of the brain and spinal cord and multi-system organ failure from the attenuated yellow virus vaccine. We've had thrombocytopenia from the MMR vaccine. We've had narcolepsy even from the H1N1 vaccine. And we thought we had Guillain-Barré from other flu viral vaccines. They found no causality now between the viral vaccines for H1 and other influenzas and Guillain-Barré. So I just wanted to point that out, because if you think that like the problems that we are seeing now with the COVID vaccine are unique, they are not. We've always seen a little bit of something, and we've been able to adjust ourselves so that we can continue on in vaccinating people. Currently, the big brouhaha is over the J&J and the AstraZeneca vaccine, and it's called VITS, vaccine-induced thrombosis and thrombocytopenia syndrome. Let's say that 5 times. Okay, so VITS causes clots in people, and it causes bleeding. Here in the US, we don't have the AstraZeneca, we just have the J&J. And 11.7 million doses have already been given. I personally ran a clinic and I gave out 203 of those, okay? And of those 11.7 million doses of J&J, we've had 36 cases of clotting and problems with that. To put this into perspective, this VITS that we're seeing, the amount and the incidence and the prevalence of it in the face of having 11.7 million J&J vaccines given, you would be 40 times more likely to have a blood clot when you are pregnant than in getting the vaccine. So you're 40 times more at risk compared being pregnant to having the vaccine. You are 30 to 40 times more likely to have a blood clot from oral contraception than you are from getting the vaccine. So overall, really, there is some problem. We've labeled it. We know it. We know who the apparent vulnerable population is. It seems to be young women. So now we've altered our recommendations that women under the age of 50 can think twice about whether they want the J&J, which is a single vaccine, and that's the beauty of it. Doesn't need to have complicated refrigeration, versus one of the mRNA, the 2 kinds of vaccines we have there. In terms of bringing this to the world, J&J is just supreme because it's a single vaccine. You don't have to go back into the village and find the same person and give them a second vaccine in a period time frame, and you don't have complicated refrigeration. Now, there's been other rumors of other problems with vaccines, and I just want you to address just a few of them, because males are not getting vaccines because they think that there might be male impotency from the vaccine, and this has not been shown to be true. Transient changes in sperm count always occur with viral illnesses, and so with the vaccine, there's a small drop in the sperm count, but it quickly goes back up to normal post-vaccination, and that's not for 100% of people. Just a small percentage actually have the dip in their sperm count. For women, it's the same thing, and for those who are pregnant, it's difficult to say this with all assurity because we don't have standardized studies for pregnant women. You just don't have pregnant women say, oh, let's give you a vaccine and see whether that affects your fetus or not. What we did have was quite a few women who got the vaccine, didn't know that they were pregnant, or quickly became pregnant right away, and then we followed them through to see what would happen with their pregnancies. And so far, things have looked beautiful. Those who have delivered well. There's been no complication. We do have 2 studies reported in May 2021. Women who actually consented to get the mRNA vaccine while they were pregnant, and in following them through, there was no demonstrated birthing issues, no changes in the placenta or the cord samples. Babies were all born healthy. Moms mounted great immunosuppressive responses, and antibodies were measured in both the cord and breast milk, giving nice passive immunization to the babies. So that was a win-win-win on all accounts for pregnancy. Talk to your physician, to your OBGYN, about getting the vaccine if you are pregnant and haven't gotten the vaccine yet. I would still recommend it. It seems to be very safe in the studies and the people that we have followed through. Now, there are problems in young adult males under the age of 30. We have documented an associated myocarditis and a pericarditis. These symptoms have chest pain, shortness of breath, and palpitations, generally after the second dose. So we have 475 cases that the Vaccine Reviewing Committee are distilling, and none of them have died. 3 are still in the ICU. 81% were never hospitalized. All the symptoms seem to quickly be taken care of by mostly a non-steroidal anti-inflammatory drug like Motrin, and maybe a little bit of a steroid on top of that. Symptoms were gone within 3, 4, 5 days. And again, the only residual primarily seem to be the 3 cases that are still in ICU, and they're distilling that to see whether they actually had some bizarre inflammatory reaction, whether they're inflammatory to begin with and predisposed. We don't know yet, but those are the cases. So what we are now recommending is just to follow with your doctor. If you get the vaccine, you're a young male under the age of 30, your second dose of an mRNA. If you should have any chest pain, shortness of breath, come on back. We'll check you out. You might just need a Motrin for a couple of days, and that will be it. Thus, that's it. The vaccines are safe, they're effective. VITS can potentially be a problem. We know how to change that in terms of not giving it to young women. We've changed our protocols. And can I just say that there are no magnets in the vaccine. There are no chips that become embedded in your arm after we give the vaccine. This is what some people are thinking. There are no protein tracers. We really can't tell which vaccine you got after we gave it to you. We can't identify. This is not the mark of the beast that we are administrating, and it's no more a part of the 666 plan than it is your last flu or pneumonia shot. But with our vaccine campaigns, something a little bit unsettling has happened, and we're getting to zero in on the PEDS question right now. As more and more of the older, elderly, immunocompromised type patients in nursing homes, those with diabetes, heart disease, kidney function, cancer patients, transplant patients, as more of the older and the middle adult populations have become vaccinated, what we have now left ourselves with is a young adult and pediatric population that are vulnerable, particularly those under 12 right now, because no vaccine is available for them whatsoever. But in the 18 to 30-year-old population where vaccines are available, their rates of vaccination are actually dropping off. It is now estimated that only 57.5% of all those young adults will have one vaccination by the end of August, and that's optimal. So we are looking at half of the social butterflies of our time who have now been congregating throughout the summer maskless in environments without protection, being entirely vulnerable to having a Delta virus invade their system. COVID truly is the disease of the unvaccinated. Only half of our adults under the age of 30 say they will get vaccinated. So is this really an issue? I mean, because the prevailing thought is that the young are invulnerable, and particularly that the kids don't get COVID, and then they do get COVID, then it's such a light case that it doesn't really justify getting the vaccine to begin with. So let's just deep dive into the kids. First of all, kids really do get COVID. There have been greater than 4 million documented reports of kids getting COVID, and that's 14.1% of all COVID cases in the US. In May 2020, so that's a year ago, May 2020, the incidence of kids getting COVID was standing at something like around 3%. Now, May 2021, it's 22% of all cases are now pediatrics. Thus, the prevalence for our kids getting COVID is increasing. Yes, we may be going ahead and testing more kids, but you can't account for a 19% increase just by testing alone. And given that there is a new Delta variant out there, there's an increased transmissibility in the Delta virus that we've noticed, and we think that it is more virulent and stronger as well. This means that our most vulnerable population, our unvaccinated children, are facing a more easily transmitted and a tougher virus. The population pool of potential victims for the Delta virus has shrunk with vaccination, and we have a new vector shift. No longer are they the elderly adults, the middle-aged, compromised, obese, diabetic adults. They are now the young adults and the kids. And while vaccinated adults could form a bit of a herd immunity around our children in a closed environment, in open societies like California's post-June 15th environment, these adults cannot shield our vulnerable ones from the influx of unvaccinated disease carriers. And for the young adults who think that, well, they're just, kind of immune to everything, that they are just rock solid healthy. I got a phone call a half a year ago from one of our medical staff guys, and he was sending in his son's girlfriend. She's 18, and she just had diarrhea. He wanted to let me know that she was coming in and if I would take care of her when she came to the hospital. And I said, of course, 18-year-old having vomiting and diarrhea. So she had vomiting and diarrhea the day before. She still felt lousy, probably dehydrated, just needs to have an IV put into her, but felt so lousy. She called 911 that day. She actually literally walked into the ambulance. The ambulance got underway to bring her to the hospital. She felt that bad that she called an ambulance. And then while she was en route to the hospital, she arrested. Stopped breathing, no pulse, no blood pressure. Paramedics quickly do what they know how to do best, and so they begin the resuscitation. They come to our doorway, and lo and behold, there is this ashen, gray, beautiful 18-year-old female who comes in. Nothing. She had no line, she had no anything. She was in terrible condition. She was really, really sick. Our emergency department did what we do best, and we did everything. So we put in lines, we put in central lines, we intubate. So we have full-on CPR going. We have people bagging her to give her oxygen. We figured that she suddenly just went out in the ambulance, so maybe she threw a clot. We're giving her TPA to dissolve clots. We're doing everything. A typical resuscitation is like 10, 20 minutes kind of tops. We worked on this woman, 2 doctors, because neither one of us could leave because it was just so tragic. 18-year-old female. 2 doctors worked on her for an hour and a half, and we could not bring her back. We had everybody. We had intensivists coming by. We had pulmonologists just coming by. We had everybody coming by. No one could offer anything that we hadn't tried, and she ended up dying. To this day, I see this doctor, this potential father-in-law in the hallway, and he looks at me, I look at him, and we just shake our heads, and we still can't believe what happened. This will just affect us. This just marks our relationship that we have together. So it's a single person, it's a single young adult, but it does happen. COVID is present in our kids. It is present in our young adults. Is it dangerous if they get COVID? In this case, yes, it was. And in 24 states and New York City, together they have reported about a 2% hospitalization for kids who get COVID. So kids who get COVID, 2% of them get hospitalized. For all hospitalizations, it's roughly about 3% of them are pediatrics. And you're thinking to yourself, wow, this is a pretty good number, right? This seems pretty low, 2-3%. And when you factor that out, this actually represents like 100,000 hospitalizations across the U.S. So if there is some mystery illness that starts sweeping across the U.S. and it drops 100,000 kids into the hospital, don't you think that we would work to find some sort of medicine, to figure out what it is, to sort of somehow to prevent it? And the answer is yes, we have. And we have developed a vaccine that is 100% effective in kids so far. With 43 states and New York City reporting, there is roughly 450 deaths across the U.S. that's been attributed to COVID infections in pediatrics. Now, in general, these are kids who have some sort of underlying disease, and underlying disease can be obesity, by the way. It can just be simply in an obese child. It can be a child with asthma, hypertension, diabetes, kidney disease, cancer, heart problems. While 450 deaths seems incredibly low for our country, this is really twice as many as would be happening with an influenza mortality rate. And now this puts COVID in the top 10 killers of our kids. Top 10 causes of pediatric deaths, COVID is included in it. Yes, most do not die, but they can get MIS-C, multisystem inflammatory syndrome in children. And in 6 weeks later, even if you had an asymptomatic case, you were documented to have COVID simply by your PCR test, but you didn't even really get a runny nose. 6 weeks later, this can totally knock you out on your butt with multi-system inflammation to the point where your organs can shut down and you can die from this. 4,000 kids have met the criteria so far for getting MIS-C. 36 have died from it. For those who haven't died from it, can have long-term sequelae like heart problems. And so this is important. And even if you didn't get MIS-C, if you weren't one of the 4,000 kids that got it, you can still have long-haul symptoms from COVID, just like adults do. Adults complain that they have brain fog. Well, kids have the same. Kids, their highest ranking things are insomnia, fatigue, concentration issues, muscle pain, and chronic respiratory problems. So kids can have long-haul symptoms too. Kid doesn't just simply get COVID and then walk away from it scot-free. Many will have long-term symptoms. Well, how young is too young to think about vaccinating our kids? Right now, we have EUA's emergency utilization authorizations for vaccine administration to children who are 12 years and up. We anticipate an EUA coming out somewhere in the fall. September seems to be a date that I've heard, but don't hold me to that. For those, believe it or not, age 2 to 11. We already have a phase 1 trial that is looking so promising for 144 kids that are age 5 down that are receiving the vaccine, and they're following them and they look absolutely great. So while there is rising prevalence of disease, significant mortality, morbidity for COVID beyond common flu in our pediatric population, there's long-haul symptoms, there's MIS-C, there's potential hospitalization, family, social, school, educational disruption. We need to steward the health of our pediatric population well. We have to look at that in terms of absolute numbers of years and quality of life as well. We are the stewards of those years and of that quality given to us by God. We have an mRNA vaccine that so far is 100% effective in preventing disease in kids. It is absolutely a no-brainer to give it to a child who has underlying or significant comorbidities, because they can get a very, very drastic case of COVID and potentially die. And to me, it's sort of a no-brainer to go ahead and protect my child by giving them the vaccine like all other vaccines, create a herd immunity in our local and global community, and put this disease to rest. We need to provide for the welfare of our kids, and that's sort of a public health issue push. And that's why we have mandatory vaccines. And for just simply enrolling a kid into childcare under the age of 5, you would have to have proof of a polio vaccine, a diphtheria, tetanus, pertussis vaccine, Haemophilus influenza type B, MMR, a mumps, measles, rubella, hepatitis B, which by the way is a recombinant DNA vaccine, and varicella or chickenpox vaccine. You need all those to enroll them into childcare. There are no personal belief exemptions from kindergarten on up in a public or private K through 12 schooling. So mandatory vaccinations have always been a part of public health to prevent our society. It's been there so that we can achieve herd immunity, and we've done so. We have herd immunity in smallpox. We have herd immunity in polio. We have herd immunity overall in general in mumps, measles, and rubella, except for those that seem to come from Europe and every now and then infect us, particularly at Disneyland. But we can't do herd immunity if we have a 50% unvaccinated population. We can't really do it if the 40% unvaccinated. And we're stretching and hoping that it will work with a 30%. Fauci just simply pulled that out of the top of his head. There is no scientific research that validates 30% vaccinated population will entirely have herd immunity, but we're hoping it will. We're hoping it will. Currently, with our school vaccinations, we look at 90% compliance, and that's why we have put most of these other diseases to rest. We do not want these diseases to be present with a 40 to 50% unvaccinated population, because then they become an unwelcome guest that is constantly knocking at our door, wanting to be let in. And unfortunately, this is now the stance that our public health officials are taking. They're no longer looking at eradication of disease. They're simply looking at suppression right now. So this is the new trend, and this is an unfortunate trend. And we hope that we can still steer it so that we can go ahead and get true herd immunity and full vaccination. So we are here, in comparison to the rest of the world, in a place of relative ease with COVID because of vaccinations. And with my medical hat on, I want to say that there is no medical contraindication to getting the vaccine. No matter what your objections, from productions to technology, 2.7 billion worldwide doses have been given, and it has proven itself to be safe. It is safe. And with this many doses given, there is no unforeseen risk that we have not uncovered, as it's been far more than 6 to 8 weeks when any sort of vaccine problem would show up. So the vaccine is safe. Get the vaccine, please. If I take my doctor hat off for a moment and then put on my Epicenter family hat, I want to talk to those who still have fear about being vaccinated. And I understand that fear separates, and that fear is very, very vivid. I was in northern Iraq, and I got into an elevator with another woman, and we were dropped because the electricity, the power suddenly went out. Timing is everything. And we were dropped. And you know that little adage, like you're supposed to like jump before you hit the bottom, crashing down in an elevator before you hit the bottom of the floor. You don't know when that is, because you don't know how far down is down. And I realized that's just a dumb thing to even think about. But we, boom, stopped, and we stopped a few feet from hitting the basement floor. So we went all the way from the top down to the bottom. And we were just waiting in that elevator until someone came and found us. Our group was like about 10 people, and they suddenly noticed the two women. Of course, it's the women weren't there, and so they went to hunt for us. And literally, it's like a movie. The doors were parted by fingers as the elevator doors were, pulled apart by our team leader, and they literally, pulled us up, out from the bottom of the elevator into the floors, basement floor. So I have fears about elevators because that was my first time. My first time was in Argentina, where my husband and we dropped several floors from the 20th something floor all the way down to the 11th floor. I ran out when the elevator finally stopped at the 11th floor, did not get back into that elevator for the rest of the trip to Argentina, and my poor husband had to bring all the suitcases down by himself, and he was such a good egg for doing that because I wouldn't get back into the elevator. I understand how fears can really change our behaviors and really just drive a wedge between us and everything else that seems to be reality. And I know that right now I seem to be the enemy for non-vaccinating people because I endorse vaccination wholeheartedly. My entire family is vaccinated. I was one of the first to get in line to be vaccinated at the hospital, even though there was no proof of how well it would go. I just didn't want to have the long COVID, long hauler potential problems of having a COVID infection. I was sure, being a frontline worker, I would get COVID because of your prayers. I never got COVID. Thank you, Epicenter family. But I was sure I would get it, and so I wanted to have the vaccine to try and just ward off any sort of long-term sequelae that I would have from it. Can I just offer to those who are not getting vaccinated that we at Epicenter, we're not going to set up a two-tiered system of those who get it and of those who do not. At Epicenter, we believe in unity, not necessarily uniformity. We will agree to disagree, but we must do so in love. We do not want to politicize. We don't want to segregate. We don't mean to demean. We do not want to set up this, two-tiered system where those who get vaccinated are at odds with those who don't get vaccinated. We don't have a blue and red seating arrangement at church based upon your voter preferences. We don't hold secret meetings for the pre-trib or the post-trib believers. And we don't divide ourselves over, the Freeway series. Heaven forbid you should be a Giants fan. But really, when we come together in Epicenter, we come together, we get messy, and we can get messy because Christ is more important than our differences. Christ is more important than our different beliefs. And based upon repeated gatherings, repeated coming together, repeated prayers, repeated intercession for one another, and mutual deliverances from our fears, from our childhood pains and abuses, from our wrong misconceptions, guided by wrong situations, from these repeated community-related processes, we remind one another of the freedom that we have in Christ. We remind one another that if we honestly listen to the Holy Spirit's leading, He will discern for us and will reveal to us the path that we should take. We remind one another of the sound mind that He's given to us and how we need to exercise right thinking as well as right feeling, right emotions, right use of our bodies, and excellent worship for His glory. We remind one another that before we judge, we must love very well, first and foremost. So, the 4 takeaways from this video. Love. Whether you're a vaxxer or a non-vaxxer, pray for us all. We are still in the midst of a pandemic, and now it's a pandemic of the unvaccinated. Wear a mask. Number 2, wear a mask at Marshall. We are on PUSD grounds. We must obey and respect. For kids who are going to school with masks, may I suggest that you have at least parents 7 masks for them, that they change out a mask every day, have an extra one in their backpack, that you wash your mask after every day's of use, rebreathing in your germs that have now cemented themselves and crusted on into your mask. It's just like no fun. Change out more frequently if there's a cold, runny nose, or cough, and you shouldn't be going to school anyway with those sort of things. Number 3, get vaccinated. I urge all families to have all members vaccinated, and when available, even the kids. And fourthly, didn't talk about this before, but consider vaccine equity. We have opportunity because we live in the U.S. Others do not. If there is an opening in the WHO, the World Health Organization, for vaccine teams, go. If Epicente's Acts of Mercy team becomes a vaccine team, please volunteer for it. If you are allowed to give so that the vaccine that you receive freely can be freely given to others, please give. Give it so that the world, who is literally dying to have the vaccine, who doesn't have a choice right now as to whether or not they want to take it, give so that they can have a choice and say yes. Thank you so much. Blessings and favor. We are grateful, Lord Jesus. Amen.